Bipolar disease is a term used to describe a set of mood swings where an individual mood changes from a static feeling to depression. There are many pharmaceutical drugs which aim to alleviate bipolar depression, such as lurasidone, quetiapine, and olanzapine fluoxetine combination. These drugs all work in a similar manner, yet have a distinctive feature that makes them unique. Quetiapine is an atypical antipsychotic drug and is metabolized in the liver by the enzyme CYP3A4 to its active metabolite known as norquetiapine. The definite mechanism of action is unknown, but it has been postulated that the drug has a broad spectrum for many receptors in the brain. Deficiency in norepinephrine has been shown to play a role in the pathophysiology of bipolar depression. Therefore, action of norquetiapine is to competitively inhibit any reuptake by blocking the NE transporter, extending the longevity of norepinephrine in the neuronal synapse. Norquetiapine can also bring about activation at postsynaptic serotonin receptors in the hippocampus, an area of the brain altered by depression. This could spur neuron regeneration in the area by increasing the release of nerve growth factors like brain-derived neurotrophic factor (BDNF). Norquetiapine's effect as a partial agonist of serotonin receptors may contribute to antidepressant and anxiolytic effects. The advantages using quetiapine are that it is the only drug approved for all three phases of bipolar disorder, so that's for acute mania, acute bipolar depression, and bipolar maintenance. It can also be co-administered with lamotrigine, which has complementary profiles. However, some disadvantages are the drug can only be given to 18 years and over, there is an increased rate of hospitalization, and must be administered at high dosage to exert an antipsychotic effect. Lurasidone is also an atypical antipsychotic drug, which is a serotonin dopamine antagonist. The positive symptoms of psychosis and affective symptoms are alleviated because of the blockade of dopamine 2 receptors. There is less motor side effects and improved cognition and affective symptoms due to the drug blocking serotonin 2A receptors, which in turn causes the enhancement of dopamine release. Moreover, mood, sleep and anxiety and cognition might be improved due to lurasidone being a partial agonist at serotonin 1A receptor, along with blocking serotonin 7 and 2A and 2C receptors. The main advantages for lurasidone include very little or no effect on histamine type 1 receptors, which explain the low chance of sedation. There is also very little or no effect on muscarinic type 1 receptors, hence lesser atropine-like effect that occur with many antipsychotics. Additionally, there is also no weight gain and the metabolic pathway is not interrupted. However, the disadvantage is that there is an increase in death rate found amongst elderly suffering from dementia-related psychosis. The olanzapine fluoxetine combination are packaged in the one capsule. Olanzapine works as a high-affinity antagonist which blocks serotonin 2A and 2C, causing a downregulation of the receptors. This downregulation results in sensitivity to serotonin, meaning that mood swings caused by serotonin are less frequent and severe. Also, olanzapine will block dopamine receptors 1 to 4 to a lesser extent than other drugs, extending an anti-manic effect, contributing to the stabilization of mood. Fluoxetine is an SSRI, blocking serotonin from being reabsorbed into the presynaptic membrane, thus increasing its levels in the synapse. With chronic use, it will cause changes in the neuronal function, leading to a decrease in anxiety, increase in mood, but causing manic symptoms that are counteracted by olanzapine. It is also a weak inhibitor of the NE and DA transporter, increasing their levels in the synapse, which is assumed to decrease the depressive effects. Olanzapine also antagonizes a variety of other receptors, such as muscarinic receptors, which causes certain anticholinergic effects, and also serotonin 3, which may assist in antiemetic effects. However, in antagonizing dopamine receptors, the olanzapine fluoxetine combination therapy will cause extrapyramidal symptoms. Moreover, the combination therapy affects other receptors similar to quetiapine in that it causes somnolence due to antagonizing histamine 1 receptors and causes sedation in antagonizing adrenergic 1 receptors. One main advantage for olanzapine fluoxetine combination is that there is a decrease in depressive symptoms. However, a main disadvantage is that it leads to suicidal thoughts. The side effects associated with these drugs are the following. The main side effects for lurasidone is extrapyramidal movement side effects, somnolence and orthostatic hypotension for quetiapine, and weight gain for olanzapine fluoxetine combination. In conclusion, many drugs have therapeutic effects but are limited due to the unknown mechanism of action and potential side effects. Ultimately, the drugs that have been discussed need further research in regards to the mechanism in order to completely understand how they are effective in treating bipolar depression.